Miss Blake, I'm Dr. Choi.
Oh, thank God. Finally, a real doctor.
44-year-old female, complains of lumbago. Pain 10 out of 10. HPI, symptoms first
Important
presented.
info. I was getting dressed for work, bent down to put on my shoes, and my back locked up.
Well, why don't we take a look? Is it okay if student Dr. McNeil examines you?
Have you done this before? Oh, wonderful.
I'll be gentle.
Guess you can't make the pain any worse. Oh! Oh! Lay on the floor for an hour hoping the pain would ease up. Nothing. Oh. Mm.
I see a surgical scar.
Discectomy.
L4, 2 years ago. Felt pretty good right after, but these days feels like a bad sneeze could paralyze me.
Unfortunately, as common as back pain is, there's not a perfect fix.
Slow, slow.
Press against my hand like a gas pedal.
It hurts. Stabbing pain. We have to do the other leg? It's gonna hurt too. So will flexion, extension, the femoral stretch, Faber test.
Been down this road a few times.
Today's the worst it's ever been, though.
What would you suggest?
CT? 5 of Valium for the spasm?
Oh, bless you. Oh.
She got on you a bit. Patients are gonna do that. Don't take it personally.
It's all good. When I was playing ball, had a no secret, ripped me a new one like no other. Compared to him, it was a peach.
I see the Valium's helping.
I'm trying to move around a little, loosen things up. Those my CT results?
Yes, scans show spinal degeneration and scar tissue at L3 through L5. We suspect it's chronic and not the cause of today's pain. That's likely structural, so...
You want an MRI. Compare it to the scan taken when I had surgery 2 years ago to see if anything's different.
Right. You know the drill.
Yeah, so I know an MRI won't show anything more than the CT. You'll give me some low-grade muscle relaxer, recommend physical therapy, but those meds won't do anything more than a baby aspirin. And I'm a lawyer, a partner at Astor Coble & Davis. I don't have time to lie on the floor doing pelvic bridges with some glorified trainer. So how about you just write me a script for what will work? Norco 10, 325s, and we can all get on with our lives.
I'll talk to the pharmacy.
I take it back. I think Nora's got the edge over my old coach. What are you doing?
Running Nora's name through the Illinois prescription database. See if she's flagged as a freaking flyer.
You think she's just trying to score pills, faking her pain?
Maybe. Dodging an MRI, then immediately pressing for meds, reaches a con job. She's not on file. Still doesn't mean we're getting the whole story.
So what do we do?
Nora had her back surgery at East Mercy. Call over there. See if she's only coming to us because they cut her off.
Dr. Choi? Just heard back from East Mercy. Nora's not on file as a frequent flyer. Never been a patient there.
Well, she definitely had a surgery. Scarring her back is clear proof.
I'll start calling other hospitals, see if she's on file somewhere else. If Nora's playing us, stands to reason she'd also lie about where she had her operation.
Maybe it's simpler than that. If I were trying to game the system, I certainly wouldn't use my real name.
So, if she's not Nora Blake, who is she?
Good question. Dr. Charles, can I ask you something? Got a strong feeling my patient gave a fake name to get a prescription.
Huh. You think we're dealing with addiction?
Likely, but can't help her with it if I can't separate fact from fiction.
You know, often when people lie, they tend to describe things in generalities. But when they use specifics, it's more likely to tell the truth. Your patient give you any details?
Type of meds you wanted. Oh, and her job. That she's a partner at a law firm. Astor, Caldwell, and Davis.
Oh. Start there?
Thanks.
There. Nora Blake is actually Brennan McDouglas.
Gotcha.
Fine. You got me. My name's Brennan McDouglas, not Nora Blake. Can I have my prescription now?
It may feel like you need them, but more pills aren't the answer.
I'm in pain. Don't you even care?
Yes, we care, and we want to help. Let us set you up with an addiction therapist who can devise a pain management strategy that doesn't involve opioids. Here's some referrals that I think you should take a look at.
No, I don't need a therapist or a new plan. I need my refill. What is the big deal? My God, I'm a lawyer with great insurance, not some junkie off the street. Or worse, some hombre that probably can't even speak the language. That guy in the next room, Mexican or whatever, he attacked a man. He fought him right in the emergency room. But nobody gave him a hard time or prevented his care. No, the doctor, the administrator, they're bending over backwards for him. There is no way he comes before me. So give me my prescription, or so help me, I will sue you in this entire emergency room.
No.
Then get out and send me your boss.
Dr. Lennox, my patient would like a word.
It's a monster! Kill it!
Baby's temp is 94. I need more blankets.
First side's in.
I start an IV, get 2 units of Onig on the rapid transfusion, start the MTP.
Vitals at 86. Turn the O2 up to 10 liters.
I got the placenta.
Heart rate's down. Pressure stable.
Baby's starting to pink up.
Hey, listen to me. You just had a baby. That's your baby.
Baby?
Call Child and Family Services. No way she's taking this baby home.
Dr. Manning,
What's going on?
he's inconsolable. I've tried rocking him, swaddling him, singing. Nothing I do calms him down. Heart rate's in the 190s. O2 sats have been dropping.
Has he been feeding?
No, nothing. Is it possible he's still in shock from the cold?
I don't think so.
I'll go see if his labs are back.
That won't be necessary. He's addicted to heroin. And he's going through withdrawal.
I heard about the baby. Neonatal abstinence syndrome. That's a rough road.
Yeah, I'm giving him fluids, Ativan, and aspiration precautions, but his numbers aren't getting any better. How's the mom?
Just wants to get out and get her next fix. Why?
Studies show that babies who are not thriving actually do significantly better when they have physical contact with their biological mothers.
So,
So I think we should have Leanne hold him for a little bit.
you can't be serious. She'd try to kill him.
She would be supervised. Even hearing the mother's heartbeat can lower cortisol levels and stress.
Leanne had 9 months to do right by her baby. She lost that chance.
Dr. Charles,
Well, I appreciate your concern for your patient, Dr. Manning, but I'm also concerned for mine. I mean, here's the problem. That baby's going home with somebody else. We let Leanne bond with him and then just rip him away. Any chance we have of helping her, we're pretty much going for good.
Dr. Charles, we're talking about an infant's life.
I'm aware of that, but I just think that we should take a beat and look at all sides of this.
Excuse me, Dr. Manning, DCFS is on their way. They've got some foster parents that might be interested in caring for your patient.
Ms. Crawford,
I told you I don't want to talk.
I'm not here to discuss detox. I want to talk to you about your baby.
What about it?
He's a boy, and he's withdrawing from heroin. He's not eating, not sleeping. Breathing and heartbeat aren't quite as regular as we'd like.
So give him some medicine.
Well, we have been, but it's not quite that simple.
Okay. So,
Leanne, adults have years to develop the coping mechanisms that help us get through life's trouble spots. A newborn doesn't have any. For him, his mother is the only thing in the world that makes him feel safe. Being held by her, feeling her skin.
you want me to hold him?
Well, it might be the best medicine we've got.
I don't know how to hold a baby.
Well, we can show you. We can teach you how to do that.
But this baby's sick because of me, right? There's no way that more of me is gonna help it.
Well,
Listen. Please leave me alone.
How are you feeling?
Fine.
You don't think I should go see my baby, do you?
That's up to you.
They say he's sick.
Yeah, he is.
I never planned on getting pregnant. You know. Whatever. You think I'm terrible.
I just wish things had worked out differently for you and your baby.
Yeah. But I guess where you're from, things work out great for everybody. Why would you understand?
Actually, I understand a lot better than you think.
Dr. Manning,
What's happening?
he's having a seizure.
Give him a bolus of Ativan. O2 sats are down to 72. He can't get any air.
Bolus is in.
He could suffer an anoxic brain injury. Give him 0.1 milligrams of morphine.
Sats down to 67.
He can't go much longer. Give him another 0.1.
Sats back to 77. 81.
He's breathing. Get a pediatric intubation kit. If this happens again, we're gonna have to put him on a vent.
And he's gonna die.
He could. Yeah,
And you really think that having me hold him is gonna help?
I know it's a lot to ask, and I just wouldn't be doing it if the situation wasn't so dire. But you're his mother, and the baby needs you. And if there's any chance at all that you're holding him might help him get better, I think we should try.
This is my fault. I did this to him. Okay.
Okay.
He's so small.
Go ahead.
Hold him close now. Against your skin.
Hi, don't cry. Yeah.
Right there.
Oh, excuse me. Can I just have a quick word with Miss Crawford first?
Okay. Hey.
Oh, wow. He looks great. A lot better, huh?
He is great.
So, they have finally made some room for him in the intensive care unit. So we're gonna take him up there now.
Okay. Oh, do I carry him up or do we take him up in the warmer?
Well, actually, Leanne, there's a foster couple up there who's gonna be looking after him from here on out.
But he likes me so much.
I know.
And he is doing so well. So I should just keep holding him.
I really wish you could. Really, I do.
But you said that he needs me.
I know I did. I know how difficult this is. I really do.
I'm sorry, but we need to take the baby now.
No. I'm his mother. I'm his mother. Wait, Dr. Charles, please.
Sorry.
You know. Dr. Charles, please, can you help me? Please, can you help me? Just explain to that it's my baby. Dr. Charles, please, can you just... Dr. Charles, can you...
Excuse me. Sean Adams, former naval aviator, now flies for a private charter company. He was doing his pre-flight check and felt faint. Co-pilot brought him in, says it's not the first time. Now I checked Mr. Adams out, can't find anything wrong. Probably just dehydrated and overworked. Says he feels fine, wants to go.
So why are we here?
Charter company wants a psych evaluation.
Uh-huh. Co-pilot says he's also been acting different. Doesn't go out with the boys anymore, naps a lot. Seems to be low energy, huh?
Sounds like depression.
Possibly.
In any case, the company won't let him fly till you sign off.
Why don't we have a little chat?
Thanks.
Just seems like everyone's overreacting.
But you can see their point of view. I mean, people put their lives in your hands.
And I'm fine. I've answered your question. I know what today is. I know where I am.
Aside from lack of energy, your co-pilot says that at times you seem mildly confused.
I have no idea what he's talking about. Maybe he's the one that's confused.
Mr. Adams, I imagine there's a lot of pressure at your job.
I used to land F-14s on an aircraft carrier. That's pressure.
Have you ever had thoughts of hurting yourself?
What? No.
Let's see here. Are you on any medication?
You mean, do I take anything that might affect my performance? No. I take a statin like 10 million other Americans. And no, I don't drink, if that's your next question.
All right, Mr. Adams. Well, thank you for your time. Getting, a little ahead of yourself, don't you think?
Well, he is exhibiting signs of depression, and there is a high rate of suicide among pilots.
Dr. Reese, trust me, I understand what's on your mind, but suicidality should not necessarily be a default diagnosis.
So what do you think?
I think that Mr. Adams is linear, lucid. I mean, he's certainly not confused.
Are you gonna sign off on him?
Well, I didn't say that. I mean, I thought he was a little defensive around the medication issue.
Well, the man has to prove himself to keep his job. That would make me defensive.
And you know what? That could be all there is to it. But look, he's a pilot. Let's just take the extra step. You know, run a tox screen, make sure he's clean.
Okay.
So, Mr. Adams, as part of our evaluation, we run a toxicology screen, and I'm happy to say that yours was normal.
I told you I don't take drugs.
However, we did find something else. Profound anemia.
Anemia?
It could explain your feeling faint.
Okay, I guess I gotta eat more steak.
It's actually more serious than that. We need to transfuse you with several units of blood right away. We also need to find out what's causing it, so I'd like to admit you for a battery scans and tests.
I've got my own doctor. I'll make an appointment with him.
Mr. Adams, we don't want you to leave in this condition. You're not well.
I feel fine.
Sean, are you sure about that?
Yes. And a car ride home and sleeping in my own bed isn't gonna hurt me.
That may not be true. I emphatically recommend that you take Dr. Choi's advice.
As far as the psych evaluation goes, am I in the clear?
Well, not listening to your physician isn't the greatest sign to me.
Well, you're not the only psychiatrist in Chicago. I'll get a referral from my primary.
Sean.
Viv, we're going. Hand me my clothes. Please get me whatever paperwork I need to sign so I can get out of here.
Be back shortly.
Sean, oh my God. Oh my God. Help, someone! Help! My husband, please. Okay, hey, I need a gurney here. You.
Can you hear me?
What's wrong with him?
Unresponsive, has a pulse. Get him in a room.
Bring it over here.
Transfer on my count. Ready? 1, 2, 3.
Here we go.
He's not breathing. Give me a laryngoscope and a 7.5 ET2.
I got Sean.
Tell me when it's prepped. We'll take care of him. Totally flaccid. Don't need drugs.
Monique,
Right?
you start the IV.
Okay, you stand right here.
He's got a massive upper GI bleed. His stomach's filling with blood.
What's the weapon?
I'm in. April, listen to his lungs.
Yep. Good breath sounds bilaterally.
All right, hang 2 units of blood and get another 4 ready.
What's going on? Why is this happening?
I don't know, but we're gonna find out.
Hang saline. Saling's up. All right, stay on it.
Huge gastric ulcer. That's where all the blood was coming from.
Were you able to stop the bleed?
Yeah, GI cauterized it, but that's not the headline. Sean's endoscopy shows chronic caustic esophageal erosions. And his chest x-ray.
Pneumonitis.
Yeah, this is a pattern suggestive of ingesting some sort of hydrocarbon.
Isn't that in cleaning products?
And lighter fluid, motor oil, gasoline. Extremely toxic. So we must be talking about low doses over a long period of time.
So, I was right. We should be concerned he's suicidal.
Well, I assume he's doing this to himself.
Well, what, you think someone's poisoning him?
I don't know, it's possible. I had a case where a wife was slipping something into her husband's food.
So you think it's his wife?
You know, hydrocarbons are extremely noxious, so he would have smelled it.
Not necessarily. They're all over any aircraft hangar. With constant exposure, you could be noseblind.
I don't know. Suicide? Attempted murder? I think it might be something else altogether. Mr. Adams, can I ask you, you ever find yourself doing something that you know you shouldn't, but you just can't stop?
I have no idea what you're talking about. My wife would say that I watch too much football.
I tell you my dirty little secret. I went through this phase where I would come home every night, cut my nails every night, like down to the quick. Couldn't stop. At some level, I must have been satisfying some urge, but my hands were bleeding. Wasn't good.
And the point of this?
The point is that I understand compulsive behavior. You know, it's not rational. You can't explain it. You just do it. Yeah, but eventually, like with me, your fingers bleed or something similar. You know, it just starts to cost you too much. And you want to stop. You realize that it's interfering with your life and you just really, really want to stop. Sean, I think you have a compulsion. And you're tired. And you're also getting scared. I mean, who wouldn't be scared? All that blood, all that vomiting?
Yes. I'm tired.
Mr. Adams, we think you're ingesting something very harmful. Can you tell us what it is? Mr. Adams, please, we can help you.
Gasoline.
I'm sorry, say again?
I drink gasoline.
Is my husband crazy? Why would anyone drink gasoline?
I know it's very difficult to fathom, but I'm quite sure that your husband is suffering from a psychiatric disorder known as pica, which involves the compulsive consumption of non-nutritive and sometimes even hazardous substances.
For some, it's paint chips. For others, dirt. For your husband, it's gasoline.
Why?
There's no unified theory as to the cause. All we know is that it manifests itself as a compulsion, an irresistible urge against one's conscious wishes.
Can he stop?
Probably not on his own, but if he'll allow us, we can help him.
Okay. We'll do whatever it takes to get him healthy.
Before we discuss the course of psychotherapy, I'd like to talk to you and your husband about repairing the physical damage.
Of course.
He could have killed himself. Sometimes we get a win, right?